Parents often wonder what it's like to bring their child to see me when they're coming with a baby that has a misshapen head or is kind of crooked or having difficulty with the symmetry in their body, and the normal activities of the child of sucking and crying and moving aren't really working out that asymmetry. I'm really looking at the whole pattern of their body from head to toe, the way they move, and the areas throughout the body that aren't carrying the forces through. The osteopathic philosophy is to really assist the body's inherent wisdom and inherent forces to work at their optimum. It's a holistic way of looking at growth and development and really trying to assist how to use those inherent patterns in the nervous system to help the musculoskeletal system become more coherent and symmetric. And the kinds of treatments that I use are cranial osteopathy techniques, and they're gentle and subtle.
He works with my son. He doesn't really force any movements or anything, that's going to tense him up.
But what we're really looking for are the places that are restricted in their movement so that you can release that tension and release the restriction. Then the inherent forces inside the child are freed to catch up and allow that area to grow.
His right side of his head was very flat and we started coming, and since we've been going it's totally filled out.
I'm not really always molding and changing the shape of the head really with my hands, but I'm really releasing the obstacles to growth so that the child can catch up and grow more evenly. We usually have a series of visits, and in between visits we're waiting for the child to grow, and we see where that growth is coming, and then at the next visit we reassess and see now where do we address next. I like to use different positions. I utilize a little front pack to walk around so that the child doesn't feel like they're being held down. You really need to be able to work with them and not fight or force. It's very hard for them to learn if they're feeling stressed or distressed by what you're doing.
My pediatrician told me he has gifted hands, and it's so true because little Forrest, my son, is just completely enthralled with him. It's a very, very easy experience for him.
Ideally, I like to spend some time treating them while they're sucking, either nursing or taking a bottle. Areas that are stiff or tight start to relax, and as that happens, you see the child relax too. Often their body language is very clear.
He explains everything to you while he's doing it, so I always feel like I'm part of his care, and really, really appreciate it. It's been an amazing experience.